Hi, I'm Dana Smetherman. I'm a radiologist with Ochsner Health, and I am so pleased to be speaking with you today about leading in times of crisis. I have nothing to disclose, and these are just the learning objectives. My hope is that after this session, you'll know more about how to develop disaster plans for your radiology department, how to differentiate between normal operations and crisis management, how to deal with the emotional impact that this will definitely have on your colleagues and employees, and also to be thinking about some opportunities as you're going through a crisis and then in the aftermath. So just a little bit of information about Ochsner Health. We are Louisiana's largest not-for-profit healthcare system. We have more than 26,000 employees and 4,500 employed and affiliated physicians. And we have 40 hospitals and specialty hospitals in Louisiana and Mississippi that we either own, manage, or with whom we're affiliated. And then finally, we also have over 100 health centers and urgent care centers. So I'm going to start the story today with someone I'm going to call Patient Zero. So Patient Zero showed up in one of the emergency departments at one of our community hospitals on March 9th. This was 13 days after Mardi Gras, which we didn't realize at the time what was probably a super spreader event on a very mass scale. He was African American in his late 60s, and he presented profoundly ill. He was short of breath, he had a fever, he was coughing, his pulse ox was low. He did not have a travel history, and we treated him like we normally would. We got a strep test, we got a flu test, they were negative. We had heard about COVID, and so although we didn't have the tests, we had a few available that we sent off to the state. They didn't come back for many days. He got chest x-rays, he got chest CTs, he got a lot of labs. It turned out that he was so hypoxic, he needed to be intubated, and we did that in our normal fashion. The intubation team came in. Many of them were not wearing masks. His results did finally come back positive for COVID. And here's our COVID curve in Louisiana. It really, like all of the rest of you, we learned quickly that we had a lot to learn, and we had to learn it fast, because between the time this patient presented and April 1st, we had 900 patients in our hospitals with COVID. In many ways, like all of you, we were not prepared, but in others, we actually really were. And that's because if you are from Louisiana, you're pretty prepared to deal with disasters. This is actually a talk that I gave at RSNA back in 2006 with two of my colleagues, Dr. Bluth and Dr. Kay, and we actually talked about disaster preparedness. And again, as I said, we don't have the luxury here in Louisiana of not knowing how to do disaster preparedness. This is just the 2020 hurricane season. And we had 7 times when we were in the cone of uncertainty. And 2 of those times, we actually had a direct impact to one of our facilities this year. I will tell you from all of those years of doing disaster preparedness that you want to be doing this planning when the sky is blue and when you have a cool head. You really don't want to wait until the storm is bearing down on you. Things that I've learned and that our institution have learned is you always want to carefully debrief after every single crisis, see what worked, and most importantly, see what did not work, and then regroup and change your processes. And basically the goal is to have fewer crises during the crisis. You want to anticipate and eliminate any potential problems. You want really robust policies and procedures. In fact, when I'm interviewing candidates, I actually tell them, expect to have to cover during a hurricane, and also have really good downtime procedures. So as we shift to COVID, I'd like to talk a little bit about our COVID response, but just remember that although the crisis changes, the principles really do remain the same. And I actually literally mean the principles. As we think about the decisions that we have to make during a crisis, we go back to our values. Our Ochsner values are patients first, excellence, integrity, compassion, and teamwork. And our mission is we serve, heal, lead, educate, and innovate. And not only that, during the COVID-19 process, we actually had an additional set of guiding principles. Our regional medical director, Dr. Laws, who is a surgeon, started every meeting and still starts all the meetings saying that in COVID-19, our guiding principles are we protect the safety of our patients, we protect the safety of our employees, and we protect the safety of our community. On the next slide, I have some things that we were able to just plug and play from our typical hurricane disaster preparedness. So within a day, by March 10th, we had our incident command center, which you actually see on this slide. And we know this was really, really early in the pandemic because people were not even wearing masks yet. We also took our standard daily huddle and inserted different places where we would do COVID updates before, during, and after. And at the bottom, come up with communications that would go to the whole staff in a tiered fashion about any updates or changes. Because if you remember, during those early days of COVID, we were changing how we did things on not even just a daily basis, sometimes on an hourly basis. Another thing that I think is really important on this slide is our Ochsner heroes. So what we have found is that positive reinforcement, in addition to that really, really robust communication, is incredibly important when you are dealing with a crisis. You really want your frontline workers to understand the gratitude that the organization and all of us feel for the work that they're doing, to give them a sense of hope, to let them know that they have a purpose and that they are really making a difference. And also, I think maybe most importantly, that we will all get through this together. There is a light at the end of the tunnel. We will work through it for all of ourselves, but we are all in this together. Another thing that has been very important for us as we look at our disaster preparedness is a sense of self-reliance. We learned through our hurricanes that you can't wait for the National Guard or the government or your vendors to come in and help you. So from very early on in the pandemic, we started doing things, and this is like almost before we had a case, partnering with our community to make our own PPE, gowns and masks, some of which were medical grade, some were not. We also partnered to build things like face shields. We started with our own 3D printing and then went to partners in the community. We even partnered with some breweries so we could make sure that we had enough hand sanitizer. On the bottom left of this slide is something that is an internal update. So if you go to our COVID SharePoint site, any employee can do this. They can look and see how many PPE days on hand we have for all of the different types of PPE. And this is actually from early in March, because one of the other challenges is, yes, you need to be really responsible stewards of these constrained resources like PPE, but you also want your employees to feel like you're taking care of them and that they know how to get these supplies. And if you were to look at this today, some of these supplies are now years and years of availability. Another thing that was really important for us as we looked to self-reliance, if you remember patient zero, it took us way too long to get his COVID result back. And so we realized that key to our success was going to be the ability to do COVID testing in-house so that we could find out more quickly who had COVID and who did not. This was essential to protecting the patients, to protecting our employees, and also to conserve precious things like PPE. So this to us was really a big step forward, but also part of one of those lessons learned that you really have to be self-reliant. So when you are in a crisis, there are a lot of decisions that need to be made, and they need to be made quickly. It is important not to forget sort of the standard format that you make decisions with in regular operations, and as much as possible to take that and shift it over to your crisis management. So I have a long history in quality improvement. I have done many, many, many iterative plan, do, study, act cycles. So for me, as we were going through COVID and making the changes that we had to make, we really tried to keep that same rigor of plan, do, study, act. If you're an organization that uses lean and uses lean principles, it's the same thing. And it's just there are so many decisions that have to be made so quickly. If you can keep a strict format and assess what works, what doesn't work, and change quickly, you'll find that you're able to actually move through all of the different phases, not only more successfully, but also in a more calm fashion, because you're using the same format that you would normally do. Also, one little tip is when you're in a crisis, you do need to keep an eye out for workflow changes that might actually benefit you in the future state. Sometimes you'll find you can fast track solutions for problems that you've been having for many years because you may have changes that get you better buy-in, or some of the barriers may be different. In fact, in academic radiology recently, NYU Langone published that they actually saw a 23% decrease in their pre-exam wait times and a 15% decrease in the overall time that patients spent in their facilities when they switched to the process redesign for patient throughput for COVID. So those kind of changes, you might find there are things that you need to improve. And because you've done things in a different manner and looked at things from a different viewpoint, you may find long-standing changes that will really stick and really make a difference. Another thing that's incredibly important as you go through any crisis is that your employees feel supported. First and foremost is communication. And as I said, we have disaster communication plans that we were able to just roll out and tailor to COVID, in addition to leader rounding and very frequent leader rounding right on the floors, right in our reading rooms in radiology, right with our technologists. We have standardized meetings, weekly webinars, but also open forums so that employees can ask questions. We used our hurricane models for how we would staff the personnel during the event, and staffing changes that we had to make after we kind of got through that first phase. Another thing, if you possibly can do it, is to give your employees a sense of financial stability. We were able to maintain our earnings for everyone. Some people had to be redeployed. Some of our employees, some of our radiology technologists, in fact, wound up being pharmacy couriers or temperature check station workers. We did, however, complete all of our performance evaluations for 2019. So we kept our standard processes. We gave people their merit raises. When the schools closed down, we actually provided free childcare for our employees who needed it. Again, if they had their childcare needs taken care of, they were able to come in and help take care of patients. We gave everyone meal vouchers for that whole 3-month period when we were in a lockdown with very reduced volumes. And we even did small things like this little sign here that any employee who wanted could take and put in their yard, and says, it says an Ochsner hero lives here. We also gave everyone t-shirts. Wellness for your employees is very important during and after any crisis. We are fortunate at Ochsner that we have an Office of Professional Wellbeing, and they have lots of different things that they've been able to offer our employees for support, whether it's in person, having a social worker go on rounds with a hospital team, or places where you can go and decompress, support lines, connection between patients who had COVID. But even if you're not at a large organization, I would definitely encourage you to look at what our national specialty organizations have. The American College of Radiology has a whole host of wellness resources. So does the American Medical Association. Some of these are specific to COVID, others are just general. The Radiological Society of North America, RSNA, at the recent meeting in November had some lectures about wellness and employee well-being. And there are also articles in some of the journals like radiology. So even if you don't work at a large place where your radiology practice can just plug into institutional resources, don't forget that our National Specialty Society organizations also have a lot of resources. For us, another thing that has been very important with both supporting the employees but making everything very clear and understandable for patients has been our very consistent branding and messaging. So this is one of our outpatient imaging centers, but if you went anywhere in the institution, you would see that same Ochsner branded signage when you walk in about masks. You would see the same Ochsner branded screening stations where we do the temperature checks and make sure everybody's wearing a mask. You'll see it at our elevators. We have these same little signs as you wait for elevators, or even when you're in the elevators. This is one of our reading rooms. It actually is a retrofitted conference room. It will have similar signage in there about social distancing, but I also wanted to talk a little bit about process redesign. All of us had to go through our workplaces and see, okay, do I have patients far enough apart so that it's safe? We put these little barriers in here, and you can see it on the next slide as well, so that our patients could be physically distanced enough. We made a lot of changes to our processes so that our patients were not so congested in the facilities, whether it was checking in from your car with an e-check-in, or getting texts when you could come back for your test, using our patient portal more to communicate with patients and using e-check-ins. And interestingly enough, we're using a lot of those same digital communication tools as we have done our vaccine rollout, both for our employees and for our patients. Similar to our patient waiting areas, we had to make changes to our reading rooms. Like most of you, you probably have radiologists, or you had radiologists and residents very close to one another in reading rooms. In fact, resident teaching happens, maybe best, or certainly it's quite easy if you have the resident sitting right next to you, but clearly sitting right next to a resident for 9-10 hours a day was not going to work in COVID. We did get home workstations, but because we didn't have them immediately available, what we did, and it's something we'd used in hurricanes, was we went to a platoon staffing model. So not everybody was working every day. We had people divided up into team A and team B. So we'd have enough people on site to cover, but also they could be spread out. We also got infection control to come and look at our reading rooms and make sure that people were safe. And of course, like many of the rest of you, we also have really leveraged those digital tools. So we use secure chat, we use Microsoft Teams, everything we can do so that people don't have to be sitting next to each other to communicate, or coming in and out of rooms. In fact, here's another sign that if you walk into one of our exam rooms, again, you see how clean and safe everything is. And in fact, we got so accomplished at this that it actually turned into a new business opportunity for Ochsner in general. We have partnered now with lots of people in our community, state and local governments, schools, public, private, and Catholic schools, and even different employers in our community, including the Saints, so that they use that same Ochsner branded material, so that their employees and their customers, as they're coming in, know that everything is safe. And so we were able to take the expertise that we had developed so quickly and actually turn it into a new service line for our institution. So it really was an opportunity. So I wanted to talk a little bit, because COVID is different than hurricanes. With hurricanes, you have an event that passes and you have an aftermath. But with COVID, you really, really have to do your crisis management, your COVID management, alongside your normal business. And this really became clear to me when I saw patients like this. So this is a breast imaging patient, a patient that I saw. She had been on an every other year screening mammogram schedule. Now, that's not what the ACR recommends. That's not what I would recommend, but that's what some primary care doctors who follow the USPSTF guidelines will do. So she had had a screening in March 2018. And then she would have been due in March 2020. But unfortunately, we weren't doing screening then. So she had to be put off and wound up not having her mammogram until the fall of 2020. And by that time, not only did she have this little cancer in her left breast that you see circled, and it's a little solid mass on the ultrasound, but unfortunately, on that image in the right on the bottom, she also had a little metastatic lymph node. And to me, this really made the point, cases like this, that we can't wait for COVID to be over for us to resume our normal operations. We really don't have that luxury. And cancer and other diseases, they're not quarantining, even though we were. There have been several studies that have come out to demonstrate what the impact of delays in care are. And for me, obviously, breast cancer is the one I know the best, because I'm a breast imager. When we look at different radiology modalities, although all of them saw a decrease in the spring, mammography actually had the greatest decrease. There's a study that showed that it was 94%, the drop from pre-COVID levels to during the spring of 2020. There was also a 94% decrease in the number of newly diagnosed breast cancers and cervical cancers and COVID cancers in March 2020. And that's not because those cancers weren't out there, it's just patients weren't coming for screening studies that would have found them. There's another study that looked at a model where they tried to figure out, well, if patients miss screening studies, how many of them might wind up, dying from those undetected cancers? And unfortunately, this study on the top on the right here actually found that 33,890 patients in the United States and 6,270 patients in the UK would die unnecessarily, excess cancer deaths at 1 year because of the results of delays in screening and treatment from cancer. And then finally, this graph on the bottom on the right, Norman Sharpless, who is the director of the National Cancer Institute for the United States, published a modeling study in which they found that there would be 10,000 excess deaths due to delayed diagnosis of breast and colorectal cancer over the next decade in the United States. Now, obviously, this is the example that I know best because this is what I do every day. But the same thing is almost certainly happening in other diseases that aren't cancer: hypertension, diabetes, vascular disease. So the point is really, we don't have the luxury of just waiting for things to be over to go back to normal healthcare for our patients. So as I said, doing this simultaneous crisis and non-crisis management may be challenging, but it is simply a necessity, because what we've done for hurricanes, although perhaps in the acute phase, we can blueprint those plans and policies and procedures, this is going on for far too long for us to just stay in crisis management mode. Also, you really can't abandon your pre-existing goals. Once this went on for a month or two, you really need to go back and look at your goals for your department or your institution. Sometimes they might have to be reprioritized. Things that seem like they were the most important thing may have to be delayed or shelved. You may also find that other different projects will become more important. For us, it was certainly the home workstations was a project that was a long-term project for us that all of a sudden really had to be fast-tracked to keep everyone safe. You may also find, many of our practices have had real financial challenges because of those decreased volumes and lots of other different shifting things that are going on in the economy. So again, you have to look at all your projects carefully. Can we still really afford this? Do we need to push this off maybe to 2021 or 2022? We definitely reprioritized our new projects because we're seeing some opportunities in our market and we wanted to make sure that we were expanding. And some of our replacement projects actually have had to be delayed a little bit. I don't know about all of you, but for us, we've seen some very interesting labor challenges, especially with nurses. There's a tremendous amount of increased competition, at least in our market. We're finding nurses leaving to go work as agency or travel nurses who are making significantly more money and basically doing the same job. And locally, we've actually seen increased competition. So, but while we're going through all of these challenges, I do want to remind everybody that look for those changes that are going to stick. I think like the digital communications for us, I think a combination, sort of a hybrid of on-site and remote coverage is something that's going to stick. Also, keep in mind that some of those barriers, perhaps it's legacy thinking on the part of our colleagues or our administrators, may actually change rather quickly. And some things that we were not able to accomplish in the past, we might even be able to fast track. As you saw with us, as we took the expertise that we gained in kind of infection control in our facilities, we were actually able to turn that into a new business service line for us. So you may find other things that you have learned how to do quickly, or you're doing a really good job that might be opportunities for you to expand your offerings. One thing that we are doing, and I think others are looking at, is all of the retail sector, sort of the bricks and mortar retail sector, has experienced tremendous challenges during the pandemic. and was already, I think, facing a lot of difficulties due to things like Amazon, et cetera. So there's a lot of bankruptcy in that sector, and we are actually taking an anchor tenant that was at a local mall, and that's going to become a super clinic for us. So you may find similar opportunities in your markets. So in conclusion, always learn from your previous crises. For us, it's our vast experience with hurricanes and other things, but look at what went well and also what didn't. Make sure you debrief, embrace the changes, and keep going. Focus on the mental health and wellness of your employees and your colleagues. This is, I think, going to be a very, very important part of what we all have to do for the foreseeable future, and also for ourselves. And then finally, if you can, as you're going through the crisis and the aftermath, try to recognize any opportunities for new business lines or process improvements that might be advantageous to you in the long term, even after the crisis has passed. So thank you again for this opportunity to speak with all of you. I do have on my final slide some websites that are the wellness resources for the AMA and for the ACR, and just some references for the studies about the cancer COVID impacts. This is the end of my talk, and I would certainly welcome questions or comments. Love to hear about how all of you have handled the COVID pandemic and other crises. Thanks again.